Buenas tardes.
Hola, buenas tardes.
Thank you, Senator, for taking time out of your very busy schedule to talk to our members today.
Absolutely.
So before we get started, I just wanted to again thank you for being on, and thank all the people who have taken time out of their day to be on this call with us, this virtual town hall. I know that everybody is clamoring for information. I know that we have been on calls and video chats and Zooms and all kind of things with community groups, with the governor's office, with individual state legislators. We're trying to deal with at the Latino Action Network with our along with our partner organizations on policy solutions to try to meet the needs of our community here in New Jersey. We've been in touch with your office constantly, and we want to thank your staff for being in constant communication with us. But you know, I'm sure you know this, but we're dealing with it on so many levels, from big policy things to immediate fixes, down to getting calls or emails from members who already had pre-existing conditions. One of our members was already in late stage cancer and told me that her garbage had not been picked up in the past 3 weeks, requiring us to call the mayor of that city and have them pick it up right away. So it's the big things and the little things. And, you know, but I got to tell you that it's been very helpful that when people have problems that fit in the purview of what you and your office do, your office, your staff has been very, very responsive. Within seconds, they are following up with people that we refer in your direction, and they've been very helpful. And we thank you again for taking this time to answer some of the questions that our members have. But now I want to invite you to give us an update about what's happening in Washington.
Bueno, buenas tardes. Thank you, Chris, for your leadership, and to the New Jersey Latino Action Network for bringing us together, even if it's virtually today. And I hope both you and all the members and families and those who you serve are safe. I know this is a tough time for just about everybody, in a disproportionate way, I think, to our community. And I know that these tough social distancing measures that the governor has put into place are difficult. They're difficult personally. It's difficult to see my grandchildren only from a window or 6 more feet away to wave to them. It's difficult in terms of those of us who have businesses and professions, and it's difficult economically. But as I have said since the beginning of the pandemic, we are either part of the solution or we are part of the statistics, and we want to be part of the solution. So these distancing measures are the only way we starve off the virus. So I appreciate all those who have been part of the leadership of making sure that that's exactly what we do, starve off the virus. You know, I have been through in my certainly my federal career through some amazing moments. September 11th, the institutional financial collapse of 2008, Superstorm Sandy, some personal challenges, but I've never been through anything like this. This is an extraordinary set of circumstances that we face. Hundreds of thousands are battling the virus as we speak. It's claimed thousands of lives, and it's been one of the most challenging parts that we could have. So unfortunately, Latinos and other minorities are disproportionately affected by the pandemic. Here in New Jersey, by way of example, we account for nearly 26% of coronavirus cases, even though we are just about 20% of the population. That's why I led 25 of my colleagues to call on the Trump administration to deal with more of these unacceptable health disparities. It's also why I sent a letter along with a group of my colleagues to all of the pharmaceutical industry, saying that in clinical trials, we need to be well represented in those clinical trials because we are disproportionately represented in the consequences of the pandemic. I also know that many Latinos are among the courageous nurses and doctors and first responders and hospital workers on the front lines of the fight against COVID-19. And certainly we want to salute all of them, but they have a disproportionate challenge as well as some of the people in our community do some of the toughest jobs: grocery cashiers, warehouse workers, delivery people who now are essential. We call them essential workers, but they're sacrificing so much to assure the basic necessities of so many. Many of these essential workers are also immigrants. They are unsung heroes of this emergency. There's about 7,500 essential workers in the TPS who have TPS status here in New Jersey alone. And nationwide, hundreds of thousands of dreamers are performing essential work, including 29,000 that are working directly in our healthcare system, doing some of the critical work we need during the pandemic. That's why I've been urging and wrote with a group of my colleagues to President Trump to automatically extend the work permit of DACA and TPS recipients at the end of the day. So let me go to what we're done so far and what we seek to do. As you know, last month we passed a $2 trillion CARES Act, which includes many resources to help struggling individuals and businesses during the pandemic. Of course, this bill is a law, I should say now, is not a perfect law. It is not the one I would have sought if I could write it, get the votes for it, and have the president sign it. It is the art of a negotiation and a compromise. But it's a compromise that many of the things that we're going to go through in this presentation did not exist but for the efforts that we led in saying, no, we cannot accept the package that you've given us. You have to include other things that are critically important. This week, again, the Senate approved another $370 billion in funding for small business, but this time we insisted in including billions for community lenders and minority serving financial institutions, because too many of our people told me they didn't even get a chance at the PPP program, which we're going to talk about in just a minute. Our work isn't done. In the next package, I'm going to fight for hazard pay for workers on the front lines of the crisis, for relief for people struggling to keep with their student loans, for fairness for all people who file taxes, including those who have an ITIN number, and mixed status families, which is just a shame that we couldn't get that even as we fought for it, but we couldn't get the majority of the administration to agree with us, and helping COVID patients who just happen to be without status in the United States. Ensuring that ICE and CBP don't get more funds for detention. And finally, helping the states hardest hit by the pandemic, because obviously what the state resources are so critically important to all of us in terms of the challenges that we presently have. So with that, let me start going through a presentation, and then I know we've had a series of questions that have been generated, and we're happy to answer a whole host of them. So let me go to the slide presentation and breaking down this federal response between small and mid-sized businesses first. Next slide, please. The law includes $377 billion in support to small businesses through various programs: the Paycheck Protection Program, the Emergency Economic Injury Grants, debt relief for those who have existing SBA loans, and certain other elements, including business counseling services. Next slide. This is a side-by-side comparison between the Paycheck Protection Program, known as the PPP, and the EIDL Grant Program and the Loan and Grant Program. So on the left, the PPP, that's basically the SBA program created specifically for the pandemic. It's for those small businesses as determined as 500 or less a 501c3 nonprofit organization or a 501c19 veterans organization who can apply and receive up to $10 million in loans. Part of whatever the amount of loan that is taken would be forgiven if it's used towards payroll, utilities, rent, and mortgage interest. And the unforgiven part of the loan, 2 years to pay up for the unforgiven part of the loan. On the right-hand side, the EIDL, the Economic Injury Disaster Loan, that can be up to a $10,000 grant, which can be used for paid sick leave, for maintaining payroll, meeting increased costs if you're producing a product, making rent or mortgage interest, which is a mortgage interest payments. And again, 500 or fewer employees. And the one note I'd make about both of these programs, you can't use the EIDL and the PPP for the same exact purpose. So if you help pay for certain workers in April and you did that through your EIDL loan or grant, you can't then get PPP for the same exact group of workers in the same period of time. So that's the one caveat. Now, SBA never ultimately goes ahead and does direct lending. It does it through approved lenders. And to find an approved lender, you can go to sba.gov/paycheck protection/find, and you will find a list of approved vendors. Now, this is where we, in the new bill that was just passed this week, insisted on changing the universe of lenders because at the end of the day, we found that too many of our community did not have a relationship, let's say, with a big bank or someone who was wired into the SBA. So we insisted on a different universe of lenders with a certain set of money set aside from the overall program so there could be greater access to them. On the EIDL grant, that you do go directly to the SBA, and you can go to covid19relief.sba.gov, and you will be able to seek it there. New slide, please. Now, we just passed what we call the CV 3.5. It's basically piggybacking on the CARES Act, the law I just described, that provided an additional money to the Paycheck Protection Program. But we included in that $60 billion that had to be set aside for smaller and community-oriented lenders to make the PPP loans. So 30 billion of those 60 billion loans made by smaller lenders with between 10 to 50 billion in assets, and 30 billion for loans made by CDFIs, community development financial institutions, small insured depository institutions, and credit unions with assets less than $10 billion. This is an effort to try to get to the lending universe that is more likely to be lined up with members of our community. Additionally, the bill also provided another $50 billion for that economic injury disaster loans and $10 billion more for EIDL grants. That's largely the program we just described. New slide, please. Now, you know, even though we are a very small business minded community, there are those of us who have businesses that are over 500 employees. For those who fall in that category, the Federal Reserve, along with the Secretary of the Treasury, announced the Main Street Lending Program, which offers loans to businesses with over 500 employees and up to 10,000 employees, or that amount in revenues. There's about 600 billion in loans available. They have a term for up to 4 years. They'll defer principal and interest repayment for 1 year towards those 4 years. But there's going to be a requirement to attest that that business meets certain requirements regarding its need and eligibility. And it also has to, many of us insisted that based upon our experience in the 2008 financial collapse, that we couldn't have executive compensation being made on the backs of taxpayer money. So put limits on executive compensation, no stock buybacks or dividends unless they were previously contractually obligated, should basically mean no stock buybacks or dividends. Next slide. As conditions to getting that money. That's for the larger universe of employees over 500. Now, I'm often asked, we just finished doing a series of interviews with Univision, Telemundo, and others about these direct payments. So let me go through them. We argued for more money for individuals and families. We also argued very strongly that those who have a taxpayer ID number, an ITIN number, should be able to be qualified for any of these programs, particularly the direct payments, and that mixed status families should be able to qualify. Unfortunately, we could not convince the majority of the administration of that view, and we did not win the day. So in terms of direct payments, only if you have a Social Security number will you be eligible for the direct payment. This is something that I'm hoping to take the fight again and try to win in the next big COVID package. But to those who qualify, if you have an adjusted gross income up to $75,000, or if you're the head of household filer with an adjusted gross income of up to $112,500, you get about $1,200 as a direct payment. For those who are joint filers with an adjusted gross income of up to $150,000, you will receive about twice as much, $2,400. Excuse me. Now, those funds, if you're above the $75,000 as the head of household filer, or above that $112,500 as a joint filers, or then you'll still get a direct payment, but it will be reduced by $5 for every $100 you're above that amount. And also in this category, an individual who has a dependent child under the age of 17 should get an additional $500 per child. Now, people ask me, when will they get their money? For those who filed, when they filed their tax returns and they filed a direct deposit with the IRS, they should have seen, or should shortly see, that direct deposit made by the IRS. If, however, they do not have a direct deposit, then they're going to get a check. That check, Treasury is telling us, is going to take a few months. We have their feet to the fire because people need their money now, not a few months from now. And so we're pushing on Treasury to get it out sooner. New slide, please. Unemployment insurance. So obviously the exact amount you can receive in unemployment insurance benefit depends on, in our state, we get approximately 60% of an individual's average earnings, and that is capped at $713. So it's 60% of what your average earnings are prior to filing for unemployment. However, between now and July 31st, in addition to whatever that amount would be that a person would get under traditional unemployment insurance, they will receive an additional $600 every week until July the 1st. So that was something Democrats fought for, to help families through this difficult period of time have the resources that they need. New slide, please. Now, of course, I've heard stories from individuals saying, I can't file, I can't get through to my unemployment insurance. Obviously, we have never seen, at least in recent history, the enormous number of claims in the shortest period of time to a system that's still using COBOL technology as its data processing. So it's just beyond in the 21st century. But anyhow, that's where we're at. So one should file, you can file online through myunemployment.nj.gov, or there are 3 numbers on the screen for Northern, Central, or Southern New Jersey. We are there to help navigate Roberto Matos Moran, who's on this call and is from my office, is a direct outreach into the community, and also the people who work on our constituent delivery services have been helping people navigate unemployment who are having difficulties in doing so. And so we stand ready to do that. The only other thing I would make beyond the fact that we extended for 13 weeks unemployment insurance. So normally it's 26 weeks. So now it's 39 weeks. And if someone had already used all or part of their 26 weeks before COVID-19 hit, they're still eligible for the additional 13 weeks. And if they expired their 26 weeks, they can go back and file for the other 13 weeks. And we also enlarged the universe as to who is eligible for unemployment, including gig workers, for example. So one who may not believe they're normally eligible for unemployment may want to look at that. Next slide, please. We know that food assistance is an issue even outside of a pandemic, but even more so now. So next slide, please. The SNAP program, the Supplemental Nutrition Assistance Program, had contained something that Republicans put in, work-related eligibility requirements for those able-bodied adults without dependents who'd have to work a certain number of hours per month. The first piece of legislation we passed partially suspended this time limit obligation during the period that there is a public health emergency declaration, because you can't be telling people stay at home and then you tell people you can't get SNAP benefits because you're not working the hours you're supposed to. Next slide, please. It also includes, the law includes another additional $15.5 billion for SNAP participants should the SNAP demand exceed the earlier budget estimates we had put in for SNAP. And there is also $450 million for something called the Emergency Food Assistance Program, which is a federal program that helps supplement the diets of low income Americans by providing them with emergency food assistance packages that are ultimately distributed by the USDA to states and participants who can get those at their local food bank. Health resources, next slide. This is something I fought for a lot. I'm proud of the federally qualified health centers we've created in our state. I've been part of a lot of them, but they're at the front lines for, particularly in our community, people who may not have insurance or people who may be undocumented. The community health centers is an all-taker system. You have insurance, you can go and get quality health care. You have Medicare, Medicaid, you can go get quality health care. You don't have insurance, you can go get health care. We don't ask about status at federally qualified health centers. So we upped our support for them with an additional $2.24 billion in emergency funding. They can also access another fund that was a hospital and relief fund, separate and apart, but this money was meant specifically for them. And for testing sites in our state, you can go to covid19.nj.gov. And for Spanish language accessibility, you can go to covid19.nj.gov/ES. This is another thing that we fought for incredibly hard in this new package that was just voted on this week. I personally believe, I think that's a belief of many others, that we cannot get the nation's wealth together if we cannot get the nation's health better. And the nation's wealth will rise with the nation's health. And the only way that that will happen is if we have the pervasive testing that is necessary, so that we won't have consumer confidence to go to a retail store or a restaurant or any other publicly available space if people don't believe that the risk of contracting the virus has been dramatically mitigated. And that can only come through testing. So one of the things we just fought for is $25 billion of additional testing funding, which we think is important in order to get the type of pervasive testing and to make sure everybody gets tested at the end of the day. You have insurance, great. You don't have insurance, you should be covered for the test so that we can ultimately determine the universe that may very well have the virus and deal with that universe versus all of those who do not. And that way you can reopen society in the most pragmatic and most cautious and effective way possible. Next slide. If I have private insurance, do I have to pay for a coronavirus test? The first piece of legislation we passed that was called the Families First Coronavirus Act, it requires all private insurance plans to cover coronavirus testing without deductibles, co-insurance, or co-pays. The bill also prohibited plans from using tools like prior authorization to limit access to testing. And the CARES Act, the legislation we passed about, I guess, a little over a week ago, makes a technical correction to ensure that the policy covers all tests that meet the appropriate standards. Insurers also have to cover fees for visits to the ER, an urgent care center, or a doctor's office associated with getting a test without cost sharing. Next slide, please. If you have private insurance, how does this bill affect the availability of the vaccine when one becomes available? The Affordable Care Act, which existed prior to all of this taking place, what some people derisively call Obamacare, but required that preventive services and vaccines covered by private insurance be without cost sharing. Normally, these services and vaccines are covered starting on the first day of the plan year, beginning after they get a favorable rating or recommendation from the U.S. Preventative Task Force. So the bill requires that coverage without cost sharing begin 15 days after the vaccine receives a favorable rating. So when we finally have a vaccine, within 15 days after that, it covers, it provides coverage without cost sharing. Next slide. And for more on all of this and other elements that I haven't discussed, you can go to our website. There's a lot more in the law, a lot more that's been happening. The 3 different packages that have been passed. But for the purposes of this call, I try to focus in on what those things I thought would be of greatest interest. But everything we've talked about and access to both sites as well as staff, you can find at menendez.senate.gov/coronavirus in far greater detail. And we update this on a virtual daily basis to bring everybody the latest.
Well,
with that, Chris, I'll turn it back to you.
Well, thank you, Senator. That was very informative. We did put out a call for questions in the lead up to this. We had to have a cutoff so we can have time to put the questions together. So I'll give you some of the questions we have. We did get some additional questions at the last minute. I will forward those to your staff, and we'll work on getting those people's answers to them afterwards. But for those who got them in the time that we were able to do something with them, I will ask them. Some of these questions you may have already answered. Some of it in your presentation, but we'll see if there's more that we can add to that. So the very first question is from one of our founding members, David Matos. And he asked, what federal grant support will be available to Latino community-based organizations for recruitment, training, and deployment of contact tracers for the pandemic recovery? It is acknowledged that there will be a tremendous demand for such individuals, and it is also acknowledged that such grassroots work is most effectively done by people from within the communities in which they work.
Well, that's a great question. And it's the most direct answer I can give is that it's too soon to know what the grant support will look like, because this part of the $25 billion that we just passed specifically for testing and for the necessary follow-up community tracing is now just signed by the president. So, but David's proposition is right on. It is why I have, in the context of clinical trials, been advocating for more Latinos. It is why we will be advocating to make sure that, especially when we are disproportionate numbers to those who are being affected by COVID-19 than our population is, that we should certainly have the ability to have the right community entities be able to be engaged in all of the elements of community tracing. So that's something that we're going to be an advocate of. The law was just signed, and so now we have to go after HHS in terms of defining exactly how they will use that money. There's some general criteria, but this is also a good part of oversight that we're going to be producing as we've rectified some of the things we've seen already wrong and how the administration has actually implemented the law. We'll be doing the same here and pursuing to make sure that communities participate.
All right, thank you. The next question also, I think, speaks to that type of oversight. The next question is from Maria Andrade. She's actually one of our vice presidents in charge of membership. And Maria says that emergency federal funding was provided so that schools can provide computer equipment to each student that needs it for distance learning. However, some schools are only providing one computer per household, even when there are multiple school-age children in the home. How do we go about enforcing the proper distribution of computers and technology to low-income children?
Well, this is an also great question, because we have seen during the pandemic that the differences in our society have been amplified, and the challenges, the divisions, the divides have been amplified. Digital divide is one of those. The CARES Act specifically contained a little over $30 billion for education, something we call the Education Stabilization Fund. This is ultimately used by the states among the hardest hit areas. It's split. 44% of the money coming to states goes to K-12 education, 46% goes to higher education. New Jersey should receive about $310 million in K-12 education assistance. $323 million for New Jersey institutions of higher education, another $69 million for something we call the Governor's Fund, which is a discretionary fund. So here is where our advocacy is going to be incredibly important with Governor Murphy to deal with Maria's question. And I certainly will be one of those advocates, but I certainly believe that the organization can be a great advocate in this regard as well, to make sure that we get the proper result in terms of computer access.
Thank you very much. The next question is from one of our great leaders and secretary of our organization, Anna Cookie Rivera, who is also doing great frontline work with the Puerto Rican Action Board, out there every day delivering food to the most neediest in the Middlesex County area, and also advocating as part of the anti-poverty network of New Jersey. So she wants to know, can you provide us with information as to the conditions for adult inmates in federal prisons and ICE detention centers? What is the status of children in ICE detention?
Well, this is a particularly challenging reality. According to the Bureau of Prisons, first of all inmate movements have ceased with limited exceptions. And every new admission into a Bureau of Prisons facility has to undergo a 2-week quarantine. Inmates with COVID symptoms are taken to the hospital, where the hospital medical staff makes decisions as to whether to test them for COVID or admit them. And inmates that test positive but are not admitted to a hospital are placed in isolation at a Bureau of Prisons facility and treated by the Bureau of Prisons medical staff. I have been militating along with others that those who are nonviolent offenders in this period of time should ultimately find release by the Bureau of Prisons. There is at-home monitoring that can be done that would be far safer under these circumstances. And in ICE facilities, I've been pressing really hard because if prisons are bad, detention facilities are even worse in terms of there's no social distancing whatsoever. So since March, the Bureau of Prisons has put about 1,440 inmates on home confinement. And we are only getting the beginnings on DHS and ICE to ultimately get people released there. That's really slow in terms of who is qualified. And we here in New Jersey have a bad set of circumstances with ICE detention facilities in the state. As of earlier this month, about 2 weeks ago, we had 186 COVID-19 related releases from ICE detention facilities in New Jersey, but that's just a fraction of the number of people. So this is something that we are still fighting on, and we continue to press.
And the children, do you have any update on what the status of the children are?
Children in ICE custody are in a family detention centers with a parent. But, you know, again, this is another example. This is the least of the least in terms of any risk that should be released at the end of the day. And, you know, close quarters put these families at risk. And there's actually ongoing litigation to release these families. And I'm hopeful that the litigation can succeed because we just cannot get this administration to understand the humanity. We can't get them to understand the health, consequences of keeping people in detention under the way in which they're detained, and the potential risk to the overall public health as a result thereof. So I'm hoping the litigation wins, but as of this time, while children are being kept in family detention centers, it doesn't make it any better.
Thank you. And Cookie has a second question, a little bit different, but still related to the COVID. Is what is known about the potential second wave of COVID-19? We have heard reports that there being several strains of the virus. What is the government doing to prepare for the next wave or waves of the pandemic?
Well, we are hearing from the experts, and for me, all my decisions, how I cast my votes, what I make advocacy for is based on science. I'm not a doctor. I'm not a scientist. I listen to those who have the expertise in terms of how we deal with this challenge. And that's why we were such strong advocates of the $25 billion that just got voted for on testing. Because to be prepared for the next wave, you have to be able to deal with understanding first, what's the universe of infection? And in doing that, you also understand the rate of infection. Once you understand the rate of the universe and the rate of infection, you understand what are your challenges looking at what comes in terms of the more serious elements, those who are affected by the virus more severely, and the mortality risk, and what you need in terms of hospitals and supplies and whatnot. So we are, first of all, following up on what Dr. Fauci, Dr. Birx, and others. I don't listen to other people, with all due respect to the president. I don't listen to what he has to say at his press conferences every day. It really should be the medical experts up there talking almost exclusively, as far as I'm concerned. I think here in New Jersey, we're at the apex of the curve. It was flattened. That's because we've had this vigorous social distancing. But the question is how long the plateau goes. And then the question of a second wave. So for me, we've got to get the testing done. That's the money that we just created. It has to be pervasive testing. That gives us the universe. It gives us the rate of infection. It gives us the preparation for what may come next. Secondly, we're working really hard on making sure that all of our health facilities are ready for that second wave, so we're not caught shorthanded. This is where the federal government has to play a major role. I disagree with the president that the states, it's up to the states to go find their ventilators and personal protective equipment. You know, states shouldn't be fighting each other for this critical equipment. They shouldn't have to compete with each other. That drives up the prices in the process. It allows for gouging to take place. But the power of the federal government to come together and ultimately do both the bulk purchasing and also order under the Defense Procurement Act, which is something I've been a vigorous proponent of, was the first member of Congress to call the president to invoke, which is where you take the power of the federal government, you go to the private sector and you say, you know what, you know, you're going to only produce, these machines during this period of time. And if you lose money as a result of it, we'll replace it. But this is what you're going to do. You're only going to produce personal protective equipment during this period of time. If you have suppliers that you need to make that equipment, we're going to get those suppliers to say that's all you're going to do during this period of time until you have the national stockpile that is ready to deal with anything, including a second wave.
Yeah. This country was definitely willing to retool our factories to create bombs and tanks to kill people across the world. But some of our leaders are not willing to do the same mobilization of industry to save lives. Thank you.
Agreed.
And thank you for your advocacy on that front. The next question comes from Jose Laureano, he's a dean, assistant dean at Middlesex County College. And he asks, emergency funding currently excludes DACA recipients from receiving any aid. What can be done to help DACA students in future bills?
Well, this is one of the challenges we have with the administration. Of course, DACA recipients have a Social Security number, so they are eligible for certain benefits that other undocumented immigrants are not. Since they have a Social Security number, for example, they are eligible to receive a recovery rebate. Additionally, those immigrants who are lawfully present and have work authorization, like DACA recipients, are also eligible for unemployment compensation. But certainly a lot more has to be done for DACA recipients. I've asked for the immediate reauthorization of all DACA and TPS authorizations, work authorizations, and other authorizations. So in the midst of a pandemic, they don't have to go scrambling. Secondly, it's my belief that DACA recipients should be eligible for all of the benefits included in the package. Of course, we didn't win that with our majority colleagues in the administration, but we're pushing really hard for that. And I must say that I recently wrote an op-ed, which I commend to your attention, about DACA recipients at the front lines of the coronavirus. So many of them are involved in the healthcare field or in the critical allied fields that are meeting the challenge. Who in their right mind? We're at a moment in which we're asking people from different countries, you know, and those who may have licenses from other places in the world to come forth, and we'll take them. Well, why when we have them right here in the United States under DACA, why wouldn't we be using them? So as we use them, we should also be giving them the benefits. So I'm hoping that COVID-4, which is the next big package that's already being contemplated, will finally make that breakthrough.
Thank you. The next question is from Ann Bakchi, and she's a public health specialist and a nurse here in New Jersey. And she asked, what is the status of federal funding for testing of COVID-19? I think you spoke to that to a certain extent. But the next part of her question is, what is the status of vaccine development?
Well, certainly the $25 billion that I just referenced several times before is going to be critically important for New Jersey to receive its fair share of that. That includes $1 billion for the uninsured, because I wanted to make sure that those who don't have insurance are going to get access to testing as well. We know at least one company will start human trials in the fall on a vaccine, and I hope they're successful. There's also another vaccine in the pipeline, but both of them expect to go to trial later this year. So the reality is we're still not looking at a vaccine probably for another year, at least to 18 months. That's just the reality, even though I know they're working, probably in the most accelerated time frame I've ever seen for any vaccine to be approved. But we also can't take risks here, right? Because you can't have a vaccine that ends up killing instead of helping. So that's one of the challenges. The other thing is, while we wait for a vaccine, I want to make sure that antivirals, those medication that could be given, but we don't have as of now, that could be given that would work, so that if you contract the virus before we have a vaccine, there's help at the end of the day. And that's something we're working on as well. And the last point I'd make about the vaccine is I wrote to all the pharmaceutical companies in New Jersey with a group of my colleagues saying, hey, we are disproportionate in the numbers of COVID infected individuals as part of the population, more so than our percentage of the population. You need to put us in your clinical trials so that ultimately we can see the results for our population as well. And we've made the same demand of the FDA.
Thank you. I know we're running short on time, so I'm going to try to run through some of the last few questions, and maybe we can give some shorter answers, because I know that you have to go at 4. So the next part of Ann Bakshi's question had to do with equipment for for people on the front lines, first responders. The president refuses to use his administration to effectively coordinate the provision of equipment. You and I talked about about the production of all the necessary equipment and all that. But what can Congress do to force is there anything that Congress can do to force the president to do his job in this respect?
Yeah, this is, this is one of the tough challenges, right? Congress makes laws, but at the end of the day, it has to be signed by a president. He's got to enforce the law. We can keep the president's feet to the fire by, the process of oversight, which of course is a little bit more challenging by doing it virtually, although we are actively engaged in doing it virtually and calling collectively as members of the Senate at different times, having virtual conferences. We just had one, for example, a week ago, I guess it was, with the vice president, who's head of the coronavirus task force, and where we pressed him particularly on testing, and that gave way finally to the $25 billion that we just talked about. So on the Defense Production Act, other than calling for the president to move on it, to engage in it, not just to invoke it, but to implement it, it's just constantly keeping his feet to the fire. But the only other way is, of course, the only other way Congress can ever make an executive, the president, do something is when, in fact, he or she wants something and you deny them that thing. And then that's part of your negotiation. So that's how they wanted more money for PPP. They said, no, not unless you give money for, minority lenders and CDFIs and whatnot. No, not more money unless we get more money for testing. I guess we get money for testing. And that's how it came about. And that's probably going to be the way in which we're going to have to do this, because there's no other mechanism for the Congress to invoke to make a president do something that he otherwise is not seeking to do.
Well, we're glad we have seasoned leaders like yourself who know how to negotiate and put up a tough fight down in Washington for us. The next question is from Henry Pena, who runs Uplift, which is a group that helps our brothers and sisters returning into society from prison. But I'm just going to just mention this question because I think you answered already, and having to do with unemployment benefits for folks with ITIN, and you've already answered that you're fighting for that inclusion in future bills. So just wanted to acknowledge that Henry had that question, but I believe that you already answered it. Yeah. And we're going to be doing everything we can in conjunction with your office to put pressure however we can and lift up that argument as much as we can. And then the last person that we have asking questions is Dina Matola Jaborska from New Jersey Citizen Action, who we work very closely with. And she asked, can we expect Congress to act to ensure that essential workers receive hazard pay and healthcare coverage for those who don't have coverage, especially low-income workers? I think you spoke to that a little bit, but if you can expand on that.
Yeah, I definitely support hazard pay for essential workers who are on the front line of the pandemic. Look, never have so few done so much for so many, and they deserve to be compensated for it. You know, in this time, we now see some of the most toughest jobs become essential, so that everybody else can stay home. So the people, in Amazon who are doing the warehouse operations to deliver to our doors, the people who deliver food, the people who are in the supermarket still having to work, and so many others. So I think it's unimaginable that the people who are doing the most dangerous work and submitting themselves, to greater risk, so that all of us can be safer, don't get compensated at the end of the day. And that's something that I fully intend. And there's a group of us who have made this case fully intend. And I want to see what is the moral standing of those who will argue against this in the United States Senate.
In the same vein, she asked about will Congress act to extend emergency paid sick days to all essential workers, because unfortunately at least 50% of workers were carved out of the Family First Coronavirus Response Act, and these are workers who are likely to be exposed while working and more likely to get sick.
Yeah, look, my colleagues and I fought hard to include paid sick leave in the Families First Coronavirus Relief Act, the first legislation that passed. Unfortunately, as the question points out, we weren't able to extend paid leave to everyone. We will certainly continue to fight at the end of the day to in the next coronavirus package. And I also would say, as we're leading that fight, I would remind that New Jerseyans, that our state leaders have also instituted a paid sick leave law that allows most workers to earn at least 5 sick days a year. I think that that's helpful, particularly at this time. And finally, I'm a proud co-sponsor of the Healthy Families Act, which would require that most employees be able to earn up to 7 paid sick days a year. But in the interim, that's beyond the pandemic, obviously. But in the interim, we're going to try to make this one of the things that we fight for in COVID for. I hope we can, anything that we try to do is the art of a negotiation. We have a Republican-controlled Senate. We have a Republican president and a Democratic House. So it's a negotiation, but it isn't like what we'd like to see is always in these packages. Sometimes, as I said before, it's only when they have something that they want, mostly about business, that we then use the leverage we have by denying them the votes in the Senate to get to 60, to say, well, only if you do this. Now, there's only so much that will bear. It's not the greatest way to legislate. It would be better that we found common ground with our colleagues and that they were advocates of some of the things we've talked about. But unfortunately, I find it more likely than not that we're the advocates on so many of these things. So we're going to continue to do that and hopefully succeed.
Well, thank you. And, I would say that because you, in the middle of this fight and as busy as you are down there fighting the good fight for us, take the time to spend an hour with us answering the questions that our members are hearing and on the front lines as they're trying to help the community. That's why we're so proud to have you in the Senate representing us. We know that you are here for all New Jerseyans, but you continue to be the orgullo de la comunidad latina. And I will say that on behalf of everybody on this call, that we're very proud that you're down there and that you're setting a great example. I know that my sons are on this call and they're teenagers, and I think you set a great example for them, as you did for me and others, of what leadership and service looks like. So we thank you, and we all pray for you as you're continuing the good fight for all of us. here in New Jersey and throughout our nation.
Well, thank you, Chris, and I appreciate all the work that you all do. You inform us. You challenge us. You educate us, and that's all incredibly helpful in terms of knowing what to fight for in Washington. Some of my best ideas, some of my best advocacy comes from leaders in New Jersey, represented by all of you. So, muchísimas gracias. Vamos a tener éxito en esto. Vamos a ganar en contra del virus, pero tenemos que, sobre todo, asegurar que cada uno de nosotros somos responsables para cada uno de nosotros. Y si hacemos eso, vamos a tener el éxito que todos queremos ver en este momento tan difícil. Así que le doy mi compromiso de que vamos a seguir abogando para nuestra comunidad en Washington, sobre todo en el medio de este pandémico y también para asegurar que cuando salimos del pandémico podemos responder económicamente en una forma que podemos progresar y realizar algunos de los acontecimientos que queremos para nuestra comunidad. Así que muchísimas gracias. Take care, stay well, and I look forward to when we will able to get together at some conference together.
We look forward to it. Thank you, and thank you to everybody that got on this call. We hope that you take back this information. It's so important. Gracias, senador, y que Dios lo bendiga.
Gracias. Hasta luego.